I was trained basically in Alexandria, where I grew up, and in Germany, and both of them really hold lots of good memories for you. But it will always be my hometown that I enjoyed the most and have more memories, lots of friends there. So Alexandria.
Tell us about your research.
All right. So I'm a nanomedicine researcher. And my lab works at the intersection between nanotechnology, microfluidics, and molecular biology. So we use nanotechnologies, or we develop nanoparticles in the lab, and we characterize them. These are tiny particles that we can load them with drugs and bioactive agents to deliver them specifically to a target site in the body. In this way, we are increasing the efficacy of this drug and limiting side effects. And we use microfluidics. So microfluidics is another technology that we use to develop those nanoparticles. And we not only use microfluidics for the synthesis of the particles, but we also use microfluidics to develop those microchips that we use them to develop models in order to test our particles. And these are our organ on a chip models. And then we use other molecular biology tools to um, study the impact of the nanoparticles on our body, not just on the organ level, but tissue level, cell level, subcell level, and even gene level.
Why is this research important?
Right. So, I mean, I described the technologies that we used, but I haven't described why we're using these technologies. So, our lab is passionate about women's health. We tend to use these technologies in order to serve the underserved women. So, women's health has traditionally been lacking funding for such research, and we have always assumed that whatever works for men works for women. And this is not the case for sure, and that research has proven that. And we are interested in specifically in my lab on pregnant women. So the aim of the lab is to design and characterize therapies that are safe and effective during pregnancy. And this means that we want to develop therapy that benefits the mother, so the baby is not affected at all, or we're trying to treat babies that are diagnosed during pregnancy with congenital anomalies before they are born, and it's too late to treat them, or maybe they don't make it during delivery. And I think this is really important because women's health is the base for human life, and especially during pregnancy, which is a very important stage of their life too.
So, you recently joined Unity Health Toronto. Why did you choose to come here and join our research community?
Many reasons. um, I will start with the community. I think the leadership here, the environment, all the team really helps us do really good research. And I want to focus on one example, the research facilities here. These are run by really brilliant scientists that are running the research facilities in the best way they can. They train our students and trainees on all these diverse techniques. And by this, they are actually taking away lots of burden from us, training new people joining the lab and making us focus on the research questions, which what really matter for us. So I mean, we can do really good research that could take longer time elsewhere. Um, Also, I think there is a big importance of working in a hospital. So I started my career as a faculty member in a university, but collaboration with clinicians, which really direct the research in different ways, happens mainly in hospitals. And we are fortunate to collaborate with many clinicians here that will definitely impact our research going forward.
Okay, 10 years from now, what are your hopes for this field of research?
Right. I will talk about women's health in specific. Um, I think. I mean, there was a study in Nature saying that female scientists are more likely to focus on women's health rather than men. So this is a reality. There are more men, like, or male researchers focusing on women's health, and we want more researchers to focus on. But we also want to create more of like an ecosystem where people who are interested in women's health, like not just researchers, all stakeholders get together, have discussions, and have collaborations in order to move this forward. And I hope that this would, with time, when researchers from different fields collaborate together with all the other stakeholders, funding agencies that get more excited about this, would lead to more products going to benefit more women in the future.